I told you you could all improve your academic test scores by up to 30% after just 10 to 20 minutes of effort? 30% boost in performance is easily a letter grade, if not more. The effort required to do that, not some sort of crazy exercise routine or some crazy intensity, it's even easier than that. It's freely accessible to all. It's what we call moderate physical activity. You see, moderate physical activity is just the amount of activity necessary to raise our heart rates right up into the point where we begin to sweat. So for many of us, this can be a long, brisk walk across campus. What happens when we're physically active is that certain regions of our brain actually get upregulated. And when we're tasked with a learning task right after that, we actually learn faster and recall it longer. Researchers at the University of Illinois were able to put subjects into an fMRI scanner even to see what the brain activity looked like after just a 20-minute walk compared to 20 minutes of sitting at their desk. Certain regions of the brain lit up like a Christmas tree. And even better, we actually get a dose-dependent response, meaning the longer that somebody goes, or the greater the intensity that they go at, the greater benefit we get. What drug company wouldn't love to say, with just one dose, you can get up to a 30% boost in performance? There's a reason why endurance athletes get what's called the runner's high. Movement is medicine. Maybe you would like to be a little bit more active and you're limited. Maybe you've got some musculoskeletal complaints. The number one reason that adults go see their primary care physician with a musculoskeletal complaint is low back pain. 8 out of 10 adults are going to get it at some point or another in your life. So if you haven't gotten it already, it's probably not a matter of if, it's just a matter of when. And when that day comes, sitting is the ultimate kiss of death for low back pain. Regular movement improves our circulation. It gets inflammation out of our joints. Our motion becomes lotion for our joints. Regular movement strengthens our bones, it strengthens our ligaments, it strengthens our tendons and our muscles. What drug can do all that? Movement is our medicine. And lastly, maybe you realize how precious time is. And time's a kind of a funny thing. We never quite know how much we have left. If we're lucky enough to make it to our 5th decade or above, we can narrow down the top 4 causes of mortality, and I think of it as the 4 horsemen: cardiovascular disease, neurodegenerative disease, cerebrovascular disease, and cancer. These 4 horsemen are responsible for taking us out of this game we call life. They're made up of a multitude of risk factors, some of which we can't control. Things like our age, things like family history, things like our genetics. But so many things we can't control. All of these things listed in blue have been shown in peer-reviewed research studies to have a positive impact when someone increases their regular amounts of physical activity. So folks, we really do have a say of some of the quality of the years that we have left, whatever that time is. Movement can be our preventative medicine. So folks, if there ever was a panacea for health, for our brain, for our body, or for the quality of our time left, movement is it. The diagnosis is clear. We can all refill our prescriptions by choosing to take stairs, by choosing to walk across campus, and stepping away from our screens whenever possible. Please move well and move often. Thank you.